I ran to the bathroom and then there was blood, like a lot of blood in the toilet, and that's when I was like, something's going on.
My foot fell asleep, which was strange because I was actually running at the time, and it never woke back up. And then over the next couple of weeks, the numbness that started on my foot slowly spread up both of my legs.
Sports were everything for me. They were an outlet. Because anger, emotions, competing. All I wanted to do was to be a good athlete, get a scholarship, and go to college. I was getting stomach cramps. I was going to the bathroom more often. But I didn't understand what was going on. I remember being in class and grabbing my stomach and I'd be like this on the desk, trying to hide it in pain. I called my mom. I left school, and then I ended up in the hospital for 4 days. They ran a lot of tests. They did scans of my intestinal tract. They did an endoscopy, a colonoscopy, and then pretty much what they found out is that I have ulcerative colitis. It's an autoimmune disease where your immune system attacks your colon and causes ulcers and inflammation.
I had everything planned out. I think since the age of 3, when every Halloween I put on a white coat and a stethoscope, and I would carry around my little doctor bag. I always knew that I wanted to go into medicine, and I worked really hard in high school. I got really good grades. I got into a good college. I did everything right. I was enrolled in the CRNA program at Rutgers. So I was in graduate school to become a nurse anesthetist, which is someone who gives anesthesia in the operating room. It's a really competitive graduate program that only accepts about 20 people per year, and I had worked as an intensive care nurse in Georgetown, and neurosurgery was my specialty, trying to earn my spot. And then that very first day in the operating room at UMDNJ, I went to put on my surgical scrubs, and I was tying the drawstring of my pants, and I realized that I had no feeling from the waist down. And my right arm had kind of also gone completely numb. And I was trying to do simple things like push buttons and draw up medications into a syringe. And I realized I couldn't even control the muscles of my right hand very well. I ended up being taken to the ER and ultimately diagnosed with MS. Multiple sclerosis is an autoimmune disease that attacks your brain and your spinal cord. And for reasons that nobody really understands, in MS, the immune system goes haywire and it attacks your central nervous system. And since nerves link your brain and your spinal cord to your entire body and allow them to communicate back and forth, damaging nerves can cause a huge variety of problems, which can range from difficulty with walking and moving your muscles to issues with thinking and cognition.
There's times where you go, nothing comes out, your stool changes, there's blood, there's severe cramps in your abdominal region, weight loss, you don't want to eat because you don't want to use the bathroom. At my worst, I used the bathroom 27 times in one day.
The tricky part about it is you never know where it's going to choose to crop up and where it's going to choose to attack. I woke up one morning and I couldn't flex the muscles in my right leg. So I knew something was going on. And then over the course of the next few days, I could no longer pick my foot up and I could no longer walk. And that's the first time that I actually ended up having to use a cane and be in a wheelchair.